Introducing the Perimenopause Bliss podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimenopause Bliss podcast.
Hey, this is Doc Yates, and welcome to the Perimenopause Bliss podcast. And today we're going to discuss anemia, because this is something that can flare up during perimenopause and menopause. It's very common in females, in teenagers. It comes up again often during pregnancy, but today we want to touch on it with regards to perimenopause and menopause. Typically speaking, the main treatment that you would see for anemia is that they would just give you high-dose oral iron. The problem with high-dose oral elemental iron is that for a lot of people it can really upset their stomachs. It can lead to stomach pain, cramping, constipation, dark stools. It's just not comfortable. So there's a few other things that we want to make sure that we address with regards to it. There's some better treatment options, and we want to make sure that we're actually treating some of the underlying issues with it, as opposed to just continuously giving iron. So, as I mentioned, it's common in teens, it's common in pregnancy, comes back again often in perimenopause, specifically perimenopause more so than menopause. So, what are some of the factors we need to consider? One, what is your intake when it comes to iron? So, outside of the supplements, I'm talking about from a dietary perspective, what is your intake of iron? So you will very commonly see iron levels to be low in vegans and vegetarians because they're not getting the same form of iron. For instance, there is iron in plants, and then of course there's iron in animal sources, meat sources. The difference is the absorption levels of those. The absorption levels of an animal-based iron versus a plant-based iron is like a 32% versus a 2%. Like, it's a very big difference in your absorption levels for that. So if you're trying to get iron in, animal protein sources is by far the best way to do it. The next thing we want to know is, okay, if you're getting the iron in, are you losing the iron? This is something that really becomes more prominent in perimenopause, because you start to see if people sometimes shift in what's called estrogen dominance, which means your progesterone levels are dropping. You start getting symptoms of this in your 40s. You often see people starting to get a lot heavier periods. Sometimes you'll see the periods spread out, but sometimes they get more frequent. So you're getting more frequent, heavier periods. Sometimes you'll see symptoms lead to fibroids. So fibroids is when you get estrogen dominance and really low progesterone. These lead to extremely heavy periods. So we need to do, there's natural remedies you can use, there's medications you can use to reduce the heaviness of the bleeding. But beyond that, we want to make sure that we're correcting the underlying hormone imbalance, which is the cause of the heavy bleeding. So if you're bleeding heavily with your periods, make sure you get that checked out, because even if you're taking all the iron that you can possibly stomach, but yet you're losing that much, you're fighting a losing battle. And then lastly, of the iron you're taking, how much of it are you absorbing? So if you have any digestive issues, say IBS or even an inflammatory like a Crohn's, you want to make sure that we're improving your digestion. Another common thing that you see people with really low iron, people that have had gastric bypass surgeries for weight loss, that really commonly leads to low iron. Another big one that I have found is gluten sensitivity. People who have chronically low iron and then some digestive issues, you pull back on gluten and then some of the other grains, and you will see the iron levels come back up without having to do supplementation. Medications can reduce your iron levels. So medications that they use for stomach acid and heartburn, we call them PPIs, proton pump inhibitors. Those, because they can inhibit your digestion, inhibit your acid production, this can also inhibit your iron absorption. So If that's the case, we've got to correct your digestive issue as opposed to just giving you high-dose iron. Now, you might have heard things like vitamin C can improve your absorption of iron, or taking it with orange juice can improve your absorption of iron. They've studied this, and it doesn't really seem to make a difference. So, if you want to do that, go ahead, but you don't need to. Now, other supplements that you can use, because again, if we need to get your iron levels up in a hurry, I'm not opposed to oral iron. I think it's a great idea, but there's different forms of iron that you can get that will get your levels up just as quickly without giving you all the stomach upset and constipation. So there is a form of iron called carbonyl iron. I've found in my patients that this gets their iron levels up just as well, but without giving them the stomach upsets and the constipation. Liver extract taken with the carbonyl iron I find works even better. That combination was great. And then if it's really low, I mean you have chronically low iron, and you can do injections or IV. Now I do offer the injections, but I encourage people not to get the intramuscular injections if they have option for the IV. The reason being is that the intramuscular injections, by putting that concentrated iron into that area, it seems to irritate the tissue and irritate the muscle, which is what you don't want to do. And the IV iron, literally, someone can go from a 0 out of 10 energy because of anemia to instantly, an 8 out of 10 within hours if that's their main source for low energy. So the IV iron is a great way to get your levels up. The big thing is that you don't want to just continuously be getting IV iron. You want to address these underlying issues in terms of why do you have low iron. So if you can get that figured out, temporary use of IV iron to get your levels up, that's the best strategy. So I hope this was helpful in shedding some light on iron deficiency anemia. And this is Doc Yates signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.